Hi, Paul Bedford here from Retention Guru. And in this clip, originally filmed at the end of 2023, I am talking to Jack from Les Mills about why I think health as a motivator for fitness behavior could be overrated and the challenges we've got as an industry or a sector in trying to encourage more people into healthy behaviors and how that's not as easy as it appears at first sight. If you've got any questions, you've got a different opinion, please put them in the box down below. Alternatively, you can email me at paul@retentionguru.co.uk and I'll get back to you soon. For now, just enjoy the clip. Take care. Bye.
On the subject of health, you recently said that you think that health could be an overrated form of motivation for a lot of consumers. How did you get to that conclusion?
Well, if you look at what motivates people, it's often, the classic thing is it's either pain or pleasure. And I think during the pandemic, what we saw was a lot of people, while it wasn't being said, it was being implied that if you were unhealthy, you were more likely to get COVID. If you were obese, you were more likely to get COVID. Now, the government didn't want to say some of those things, but I think everybody got that message. And so you had people who were going, I might fit into that category. I'm going to start exercising. But because we had the open and closing nature of the pandemic, we were open for a bit, closed for a bit. Those people never really established a behavior and so dropped away. And once it was felt that, okay, we're safe now, even though we may or may not be, it's like, actually, I don't need to pursue that behavior anymore. Now, we did some research probably more than 20 years ago now for the YMCAs, looking at why are people physically active and things. And we wanted to see if people were motivated by their health. And one of the key findings was that people were, when they were unhealthy, they valued their health. When they were healthy, it wasn't a consideration. So it's this bizarre thing. It doesn't add to the motivation if you're healthy, but if you're unhealthy, you're motivated to get back to health, and therefore you'll look for activities that might drive that. I think the other challenge with health is different age bands value health differently. As I age, I value mobility more than I've ever valued it, and flexibility more than I've ever valued it. Much more now than I used to, whereas I used to value strength and cardio endurance. So I think age bands start to determine what motivates you. But I think you've also got health doesn't have almost like a finish line. So it's this infinite project you're working on. Whereas if you haven't got any measures to determine how healthy you are, and I know you can do relative age and you can do blood chemical analysis, things like that. But for most people, it's like, well, I feel fairly healthy, therefore I've probably done enough, as opposed to people who are really into their fitness, who are like, actually, health is a secondary, it's a byproduct of my fitness program. It's not necessarily a thing I'm motivated to do.